Can I get you to kind of face the bathroom door and comfortably bend forward for me as comfortably as you can? Legs straight, keep bending. I'm looking to see how your spine's moving. Keep going, keep going, keep going. And come on back up. And so you're having back issues, correct?
Mm-hmm.
Yeah. Bend once again, please. Yeah. Which side is bothersome, or both?
Both.
Okay. Okay, hang with me. You can keep that right there in place.
Okay.
Yep. And rest. So a little bit sway back. You still kind of have that postpartum. There you go. There you go.
There we go.
So do you feel this hand's at your thoracic
Yeah.
girdle? So right
Yeah.
around your trunk and ribs here. The bottom hand is kind of at your pelvic girdle. And you just corrected beautifully. Okay, can you comfortably I want you to extend and reach your hand towards the right hand towards the back of the left calf. Good, 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 good. Come on, back up. Alternate. What's happening? I hear you groaning.
It's just, I mean, it's very, like my low back is just very tense and sore through here.
Okay, and come on back up. Come on
Like
back
this side, I feel like that.
up. Okay. Do you feel like where my fingers are, they're on the underneath side of your ankle bones? Do you feel like they're in the same position head to toe, or is one thumb closer to your head and one thumb closer to the window?
Seems like this side is closer to my head.
Actually, what I'm feeling here is your right malleolus is closer to the window.
Oh.
And same thing, same thing with the knees. This one's slightly closer to the window. I'm gonna have my hands on your pelvis. And slightly, again, a little bit closer to the window. And can you feel where my hands are here at the top of your ilium?
Yeah.
So do you...
This one does feel a bit higher.
And this one feels a little bit
yeah,
this way.
that's weird.
So I'm noticing that the entire right leg is a little bit closer to the window relative to this one. A couple things can be going on. Can I help leave your bottom where it is? Let's come on up into a long sit position. Perfect. And let me take a look back at your feet. Let everything soften. Thank you. So that seemed to really kind of help level things back out a little bit. Okay, so come on back to your back. And I'm going to put a pillow underneath your knees just because it'll help your back feel a little bit more comfortable. Thank you. And tell me if that's okay for your back. Okay. So if I can, I'm going to take your hips through some movement to begin with.
Okay.
I'm going to keep you covered. I'm going to drape this between your knees. I kind of want to see how your hips and pelvis are moving. So let this be just kind of floppy. Let me take the weight of it. Sorry for that lamp, Mags. Perfect. Beautiful. Rest. I'm going to turn your knee in and your ankle out. Is that about it? And the knee out and the ankle in. Let your thigh fall onto my thigh. Perfect. And I'm going to feel along this inside thigh muscle. I'm looking to see how these feel. Are they pick up? Do they move? Are they bound? Are they sticky and stuck to the tissues beneath? And things feel like they're moving pretty well. Same thing. Before we even start, bend your knees again. Bend your knees. Put your feet flat. Now, lift your head up for me. Yep. And I'm looking and feeling for how well the side walls of your abdomen have come back together after delivery. And I'm feeling the side walls touching, except for right there, just barely a finger width, and your finger width.
What about at my belly button?
Okay.
Do you think this feels...
It's perfectly fine.
Okay.
Use your finger, and I want you to kind of march down. Are you feeling... Okay, give me your finger. Give me your finger.
Okay.
Give me... Are you feeling this on the edges? Yeah, that's what we... Okay, so
we
those
want
are the
that.
side walls of the rectus. The side wall of the rectus.
Yeah.
If you had a...
I guess I was expecting it to like come back together and like not feel that valley at all.
Your valley
that's
is
not.
totally within normal range. It's within a normal limits. The other piece that people need to understand about with diastasis is that it's not only the width of the separation, but it's the integrity of what we feel at the bottom of the gap. Okay? So the way, it's like we want to feel a trampoline at the bottom. If you could poke your finger and get to the floor, down to your tailbone, oh my goodness, we'd have an issue, okay?
Right,
So we
okay.
want to be able to generate some tension. And the way we generate tension and protect those sidewalls to stay together during activities of movement, laughter, picking up, hauling your children around, is to generate a pelvic floor contraction and activate your transverse abdominis. So your transverse abdominis is going to be a deep muscle of the pelvic floor as well. You can palpate it inside of these hip bones here. Let your belly soften. Yeah, perfect. So put your fingertips here. And I want you to think about piling into a size 0 pair of jeans, and you needed, as if you needed a 4, but you want to get into a 0. So generate a little tension, bringing this finger to this finger, bringing your belly button towards your spine, and you'll feel a little bit of some bulking, much softer, gentler, gently. There you go. So this muscle, the TA, transverse abdominis, is best friends with the pelvic floor. So this muscle runs this way, the pelvic floor, and it runs all the way around to the back. It's deeper beneath the rectus and beneath the obliques, but it's a girlfriend to the pelvic floor. They go everywhere together, okay? So they're best friends. If you're generating contraction in the pelvic floor, I want you to remember to generate a contraction in the TA. Okay? I call this your skinny jeans muscle. I call your pelvic floor.
I like that.
Yeah, your skinny jeans muscle, okay? So you need to have your skinny jeans on, tightened, and your pelvic floor or your elevator. I talk about the pelvic floor like an elevator. So if my finger's in your vagina, you Kegel, you should be able to squeeze, pull up this elevator to the 3rd floor, pull it to the 4th floor, let it down to the 2nd floor. I want you that coordinated, okay? But the TA and the pelvic floor are friends. It doesn't matter whether you generate tension first in the TA or the pelvic floor first, vice versa, but eventually I want them both recruited.
Okay.
Always for laughing, pushing, pulling, anything that increases intra-abdominal pressure. If you're trying to slow the stream of urine down, hold back gas, squeeze around a tampon, squeeze around a penis, those are pelvic floor muscles. These are helpers, but these are not pelvic floor muscles.
Right, okay.
These are skinny jeans muscles. These are elevator muscles that run this direction, like the bottom of the, here again, I'm reviewing. Top of the core is the diaphragm, bottom of the core is the pelvic floor.
Right.
They work in tandem together, so that's the first thing we're going to look at in just a second.
Okay.
May I feel your skull?
Yeah.
Let your legs come down and rest. Perfect. So when we look at a scar, we want to see that it's moving, that it's pliable, that it's not generating any restriction, that it's not generating any discomfort. Your skin looks beautiful. And we want to be sure that this scar is mobile in every direction. And we look at scars also top to bottom, not only on the surface, but we're looking at tethering and tension deep. Okay, so when we make this, when the surgeon makes this incision, it's not just the top layer. It's, if you think about an ice pick going into you, or a laparoscopic surgery where they take a camera and poke a scope into you, they're dragging and poking all the way through muscle, skin, fat, subcutaneous, all that gets drugged down. So I want to feel, so to me, there's a tiny little bit of restriction right there. Do you notice it?
Yeah.
Okay, yeah, and come on back and rest. So what we can do is kind of work on this. And I'm moving a little bit too quickly just for assessment purposes, but I want to be able to.
Is that what people mean when they say they it should have, that you should have tissue work done on your
soft tissue
incision? Okay.
Yeah, exactly.
There's another, this is like, it's like I'm just following everyone on Instagram, but
Good.
there
Put me
is
on
a
there.
fitness person I follow called Nancy Anderson, and she has had 2 C-sections, but she's really into like the C-section recovery. She has like a whole C-section recovery program, and one of the things she says is you should absolutely have tissue work done on your incision area. I don't know, for like pain recovery, things like that.
To me, I'm not seeing a lot of immobility. I'm not seeing a lot of bound downness. I'm not seeing a lack of movement. Do you feel that there's something specifically that's not moving or that's generating pain elsewhere?
No. Okay. I mean, like when I was describing like when I run and saying I have pain around my incision, it's not like the actual like incision that hurts. It's like that's just the area that I can describe. It's like from here down that hurts when I run.
Okay.
So it's not the actual like scar. Yeah. It's just that area. I don't know.
The whole kit and caboodle.
Right. Yeah. I don't know how else to describe it.